The overarching mission of the Cancer Surgery Standards Program is to improve the surgical care provided to all patients with cancer. And there's really three primary objectives of the program. The first is to work with the ACS Cancer Research Program to develop evidence-based standards for the technical conduct of surgical procedures. In fact, our program has its origins in the Cancer Research Program Cancer Care Standards Development Committee. And the CSSP will continue to work with that committee to bring operative standards forward for accreditation purposes and other purposes. The second goal of the program is to implement documentation and communication tools designed to ensure that surgeons adhere to the standards that have been developed. And finally, the third goal is to educate surgeons, trainees, registrars, and others in the proper conduct of cancer operations. The evidence has told us that adherence to technical standards for cancer surgery, such as those described in the operative standards for cancer surgery manuals, actually improve post-surgical outcomes. So we have data that patients whose breast and gastric cancer operations meet technical standards actually live longer than patients who don't. So really, the most important thing we can do in the CSSP is continue to develop these technical standards with the Cancer Research Program and implement them in such a way that surgeons can implement them in their daily practice in the most easy way possible. We've worked with multiple disease site experts, such as experts within the Commission on Cancer, the NAPBC, and the NAPRC, to create and implement both the standards as well as the tools designed to monitor adherence and document adherence. So we'll continue to work with individuals from these groups very closely, as well as individuals from the ACS Fellows Association, for example, and the Resident and Associate Society, as well as individuals from the cancer registry community, to ensure that we bring about standards that are most clinically relevant, educate all of these individuals on how they should be implemented, and educate trainees, residents, and others. I would say that one of the most important things that we're doing in the CSSP is not only creating and developing evidence-based standards, but also developing tools with which adherence of those standards can be monitored and documented. And I want to emphasize that these tools include the development of very robust synoptic operative reports. These may be similar in some ways to synoptic op reports that have been developed by individual surgeons and individual institutions, but we look forward to the implementation of these reports that have several potential advantages, including the inclusion of data fields, for example, that allow monitoring of adherence to COC standards. They include tools so that the data included in these operative reports can crosstalk with other ACS information systems, such as the NCDB, for example, and so that the data included in these synoptic op reports can be used for individuals and institutional research. I also want to emphasize that these tools are designed in such a way so that their use will be transparent and should not require any significant additional work on the part of surgeons. So I know that there's potential anxiety with respect to new workflows that may be required to document adherence to these technical standards. And I want to emphasize that we acknowledge that this is a potential concern, and we're working hard to ensure that that is not an issue.